Hello, everyone. I'm Judith Zelikoff, and I wanted to thank you for joining us on our live snippet series. I'm a professor at New York University Grossman School of Medicine in the Department of Environmental Medicine. And those of you who have visited and come on board for our snippet series, you know that these snippets are brought to you by the Community Engagement Corps from our NIH grant for the Center for the Investigation of Environmental Hazards. As many of you know about our snippets, each time we're on, we have a researcher or physician who can talk about different topics that they're experts in. And many of these topics have been selected by the communities that we work with, including those in Brooklyn and Native American populations. So usually these snippets are anywhere from about 20 minutes to a half an hour, but no longer than that because we value and respect the time that you have available for these. As you also know, or may know, that these snippets are a time series where we depend upon your questions from as a participant for our expert to discuss. Anything that you may have a concern about or are curious about, now is the time to bring forward. So we have two people today from our vaccine center in Brooklyn and from the NYU Center from Vaccine Institute. And I will introduce Dr. Lalitha Parameswaran. And she is, let me just talk about her a little bit. She is a physician and co-lead of the NYU Langone Vaccine Center in Brooklyn. She's also an infectious disease doctor and specializes in inpatient management of complex infectious disease patients. She also has a master's degree in public health, and with that degree, she focuses on community health education. Our panelist will be Akeem Moore. He is also from the NYU Langone Vaccine Center at the Brooklyn site, and he is the operations manager for the NYU Vaccine Center there. He handles the day-to-day operation and makes sure that there is compliance and planning for all the vaccine studies that are carried out there. He has experience in clinical as well as animal models and translation. He's worked on a number of cancer studies, bariatric studies, and now his focus is on vaccines and treatment of COVID and other diseases of public importance. So we will begin to talk about COVID, the facts and the myths, and also questions. Of course, this whole snippet depends upon your questions to Dr. Parameswaran. So please, we'll begin now, and feel free to write in the chat. You can see the chat, and please ask any of your questions. So let's begin. So I guess, you know, with COVID being on everyone's mind now and the vaccines that have come out and now the CDC information, I'm sure everyone has a lot of questions. And some of the questions I know that have been on my mind and Ms. Shaw's mind, who is the community coordinator for our program, are things like, if I already had COVID-19, do I still need a vaccine or am I immune?
So great question. I think what we know so far is that having COVID-19 and having made it through the infection doesn't always give you full protection or what you would call immunity from the virus. It seems to, based on many of the research studies, at least give you some short-term protection. But long term, I would say that the protection may not last. And this is because, as everyone's aware, there's multiple strains of the virus that's circulating across the globe and also within the United States. And you may be immune to a specific strain and not the others, or your immunity may not be powerful enough to the other strains that are more recent. And then it also depends on your original infection. Did you have a really bad infection? Did you have an asymptomatic infection where you didn't even feel it? So all of these things go into it. So I think it's not safe to assume beyond a short term that you're immune to the virus. So I would suggest getting vaccination. And vaccination will help make your immunity stronger. If you have a pre-existing immunity, it'll boost your original immunity and possibly give you good protection.
Thank you. So another question, should I pick the vaccine that I want? I'm a little nervous since AstraZeneca was halted and Johnson & Johnson, you know, how should I choose, or should I choose?
Yeah, so I think AstraZeneca is not approved in our country to choose from. So that one's out of the choice list, but we are incredibly, incredibly lucky. And I say this because my own home country is going through the worst crisis, of their kind, which is India. So we are incredibly lucky here to have multiple choices. Now, the J&J did go on a pause, and it was for a specific reason, for a specific age group, which was women less than 50 years old. There were rare reports of blood clots and low platelets. So you may want to think about some of your risk factors and your medical issues to decide whether you want to go and take the J&J vaccine based on what was found. But otherwise, between the other two vaccines which are approved, they have been found to be pretty uniformly good. And I would take whatever you can get, at least. If you have no risk factors for J&J, you have really nothing against Pfizer or Moderna, and you have all three available, then I would just take the earliest appointment you can get and get the protection.
Thank you. So I hear a lot of questions about, children aren't really getting sick. And yet the CDC and the states are opening up and recommending that children and adolescents get vaccinated. Why should I? So
it's true that children didn't fall sick as much in large numbers as adults did, but they did fall sick. So, and I don't know about everybody, but most people can tolerate their own illnesses, but cannot tolerate their child going through anything. So the other aspect why children need to get vaccinated is that they may spread the disease more easily. They may shed viruses much more often. If you think about having a young child who goes to childcare and bringing back some of the respiratory infections, I'm sure all parents have gone through colds and coughs and, in the first 2 to 3 years of their child's life. I know I did. So there's multiple reasons for vaccinating children. One would be to make sure they are protected, which would be a paramount because we still don't know what the long-term effects of COVID are, regardless in children or even adults. It may have long-term complications that we just haven't found out yet, because we really have this experience with the virus for 1 year. And then we have, now the CDC's approved the vaccination for over 12-year-olds. The information available from the trial is really promising and looks, even better than the adults. And children's immune system responds so well that perhaps they will mount the best response for a vaccination against the virus. So I think there were a number of factors that went into this recommendation for children to get vaccinated.
Understood. So I'm watching this video because I'm trying to decide between getting the vaccination and not getting it. Can you help me to make that complicated decision?
Yeah, I can understand how our life has really changed. We went from being, very carefree and having a booming economy and, walking around and doing our own things like socialization to a period where everything was in a lockdown. And now, there's vaccinations available and people are skeptical about, oh, what is going on? So I completely understand. It's been a huge change for the human population to go through. And I think I respect that. I respect that feeling of, oh, is this real? And should I do this? However, the virus is a lethal virus. I'm an infectious disease doctor. I worked throughout the pandemic. I saw the really terrible, terrible effects of the pandemic on young people, older people, on families. So as a personal decision for me and my family, I could not trust what this virus would do to my body, and I could not trust that there would be no long-term complications. The science of the vaccines and the way they were developed were, being a vaccine researcher, I know were very, very rigorous. So for me, the safety concerns of the virus were worse than, my concerns for the vaccine, and I wanted to protect myself the best way as possible. So that was my thought process. And if that thought process that I went through would help you, then here it is. The other things I would also consider is who belongs to your household. So, you yourself, whoever is hesitating or thinking about getting the vaccine, may be a healthy person, but the people within your circle may be more prone to getting severe COVID infections transmitted through the unvaccinated person. So, how do you want to protect your household? How do you want to protect your loved ones? So I think you have to think closely about all of those things and make the choice to have a vaccine or not. And those are some of the things that most people think about.
So we have several questions now coming in, but there's one that I want to follow up with on that. And I've heard this as a scientist. It's my body, it's my choice. And people feel resentful in being pushed into something. How do you address that? Can you address that?
I think the goal is not to push anybody into anything. So my goal is never to force anybody into anything, be it be an antibiotic that I want to give for your infection, or be HIV treatment or hepatitis treatment or whatever it is. Decision making, for me at least, and for a lot of doctors that I know, is a partnership. So you have to be invested in your own health, and a lot of decision rests with you. All I can do is provide you the information that will help you make the decision. So I can tell you and reassure you that the vaccines are safe. There's extremely close monitoring going on for potential side effects. The rate of publication of the research on the vaccine on COVID is unparalleled. All we've been reading about is research articles on COVID, and that's across the world. So the currently available vaccines in the United States have been given in multiple other countries. So I think there is a lot of safety related information that exists now in multiple different populations, and there has been no major safety concerns that have been elicited. And when you have a J&J pause, that the government is looking at these things, and not just our government, but multiple other governments. So these are good things. The pause was a good thing. They looked at the information. They said it's a very, very rare side effect. So I think, thinking about the way the vaccines were developed, these were technologies, like, for example, the J&J technology was approved for Ebola. So it's been in existence for a very, very long time. Similarly, the mRNA vaccines, which are the Pfizer and Moderna, they've been in development for a while as well. So it just appears as though they appeared by magic, but that was not true. The research has been going on for decades. There have been papers published in various journals for decades. So I think, you have to, again, it's an individualized choice. I never try to rush people or push people. One must make a, decision weighing the pros and cons. And that's a separate decision for everybody.
Okay, we have a number of questions here. So how long will COVID vaccine immunity last?
Oh, that's a fabulous question. If someone can answer that in today's chat, they will get the Nobel Prize, I think. But what we have so far is that the companies that develop the vaccines, the trial participants, we're getting a lot of information from looking at their immunity. And it seems that the vaccination related immunity for sure, appears to be good for 6 months because we do have some data that came out. Originally it came out in November when the vaccines received the approvals. Now it's another 6 months since then. We haven't received confirmation yet, just some data are coming out. So I suspect we're going to know this soon. We just don't know it at this point in time. Like I can't give you a number, but we're going to know it soon. But there have been no concerns about lacking, like the immunity is not just waning down. It seems to be working quite well, even at this time frame.
Thank you. Question about whether NYU or actually any other institute or academic environment have clinical trials going on now to assess lasting immunity.
Yes, there are multiple trials going on. I see my ops manager extraordinaire just come on. Hi, Akeem. So this is a great question actually for Akeem. I don't want to throw the question at him, but we have a number of trials which are looking at immune responses to vaccinations, multiple different types of vaccinations. They're going on at Brooklyn, at our research center in Brooklyn, in Sunset Park. And we also have, just studies on COVID and how are vaccinated individuals doing over time, so that we know if there is a breakthrough infection, when did it happen and how can we help? So we have these trials available for participation across greater Brooklyn area. There's multiple other sites as well in Manhattan. And if anyone's interested, I'm happy to share our phone number to call, and they can participate and find out if they're a candidate to be in one of these trials. Akeem, do you want to add anything else to this statement?
No, that was a great answer. We do have the biorepository, and we're looking to get as much information from people as possible. And in the future, we're going to be continuing trials with different sponsors, different investigators and collaborators. So we're always working in the immediate future for COVID-19 now, and then hopefully for years to come, we'll be able to continue to do research and provide answers to these questions where the answers really are factually, we don't know.
Thank you. Thank you both. Another question. Is having a strong immune response to the vaccine, like fever, chills, nausea, headache, is that a good sign versus someone who, like myself, who had a headache, went to sleep, woke up perfect? Is that is that an indicator that perhaps the vaccine is not working as well on someone who had dramatic symptoms?
Yeah, that's actually an awesome question too, but I don't think we can say one way or the other. Some people's physiologies are very different. So you may digest something very easily one day, and then 1 month later, you may not digest the same thing very well. So it's very similar to that. So it's hard to compare immune systems between people. So some people have zero response, to any vaccination. Like they don't get any symptoms at all. But they're fine and they go through life without having any problems. And some people get a fever for pretty much everything. You get a vaccine, you get a fever, you get a cold, you get a fever. Their constitution just mounts a temperature for, small things. Any change in their physiology, they respond by mounting a fever. So it's very difficult to say that the person who does nothing has a flat immune system and the person who's having a fever has a wonderful immune system. I don't think we can say that. And that's the same as any other condition. It's hard to say why certain people behave the way they do. It's in genetics, and our immune system is a part of genetics. So, I think if you got the 2 vaccines, excellent chance that you're protected from COVID. Doesn't matter how you responded to it.
Akeem, at any point, if you want to add anything, please feel free to.
Sure. I was just going to jump in there and say after my first dose, I had a fever for a day, and then I had some soreness So I would like to think that I hope it works, because I hope that I didn't go to that for nothing. But I will say that I also had COVID back in late October, and I had a fever for about 12 days, brain fog towards the end of it, chills, and having COVID. And I would say that's a mild case compared to how it would be having COVID and then having 2 doses of vaccine. I would take the vaccine again to avoid the experience from having COVID.
So what do you say? I know people, and we're getting that question. I had one, but I'm really not sure whether I should get another one. Am I protected? Am I partially protected? What do you say to people who feel that way, or what can you say?
Yeah, the clinical trials, they're talking about two shots given a certain interval apart. That's how they got these numbers, these amazing numbers that provided all this protection. So in order for you to get the full protection, that's how you take the vaccination. In general, if you look at vaccinations on the whole, they work on this strategy, which is called prime boost. So the vaccine introduces and educates your immune system the first time. The second vaccination is just to like a reminder, like a test. Hey, here I go again. And then the immune system remembers, oh, I remember seeing this 3 weeks ago. Now I'm going to come with my full arsenal because that thing is back in the body again. We need to kick it out. So that's how durable immunity is produced when you do this sort of prime boost. It's almost like studying for a test. You take test prep before the actual exam comes, and this preparation makes you stronger. So when you encounter the actual virus, your body's all ready to go and fight it off.
So in a follow-up to that, we know that many places are developing, already Pfizer is developing boosters. So what are your thoughts, and Akeem's, about, do you anticipate having to take the vaccine annually, like the flu shot? And do you anticipate needing a booster shot for those who have taken the vaccine now?
Yeah, it's a tough question to answer, and I will go out on a limb and give an answer, which maybe I'll paraphrase it by saying I may not be fully accurate because we just don't have that information. But based on what we know so far about the virus and how it's developing these variants, by variants, I mean the different strains that are circulating in the globe. There is a Brazil strain, there's an Indian strain, there's a UK strain, there's our beautiful homegrown New York City strain. Based on that and how the virus is behaving, I suspect we will need boosters. Whether it's going to be annually or once in 2 years, I don't know yet. It's hard for me to predict that, but I suspect we're going to be getting boosters. And again, what interval we're going to get it is also up to question. Akeem, do you have any other ideas? Because you've worked on trials.
Yes, I worked on the Pfizer trial, and the individuals that were in the phase 1 trial that started last May are already on what we call like a booster cycle. That's been less than a year. We don't have any solid data from that yet. But I will, just to kind of jump along there, say, not most, but a good portion of vaccines do require a booster at some point. As you get older, human immunity begins to wane. So whether this is like yearly, or maybe like a flu shot, which is not a booster, it's an entirely new shot, like Dr. Latham was saying, or this is a booster to make it stronger over time, we could expect that. And I assume that over the course of, this is very prevalent now, but over the course of the next 5 years, 10 years, next several decades, we'll be able to expand our, hopefully, fingers crossed, we'll be able to expand how far we need to take these COVID vaccines, because the viruses won't be as prevalent and as terrorizing as it is now.
So jumping over for another question, I'm sure that since I'm confused, and I'm a well-trained scientist, since I'm confused about what to do now with the new CDC regulations or suggestions or recommendations, however they're called, and the different states, should I keep wearing a mask Should I not wear a mask? Should I only hang out with people who are vaccinated? Can I have some advice?
Yeah, this is sort of like a hot topic right now, right? It's a controversy of summer, I would say. So I think everyone is largely confused about these recommendations as well. So you don't have to feel alone or blame yourself for not understanding the guidance or having some thoughts about it. So I think for me, it's always been about vaccination and ventilation. So I'm less concerned about COVID spreading outdoors. Even if there is not enough space for sort of distancing, or there's a lot of people, it's just based on the airflow. There's just more airflow in an outdoor space for most outdoor spaces, and the virus is not as efficient jumping from people to people. So it's easier for me to accept the mask guidance and follow it in an outdoor space. The indoor spaces are a little tricky, especially in New York City, because we all use public transportation. Taking my own case, I work in a hospital. So for me, life is going to really look no different from what it's always been. I'm probably going to be wearing a mask in most settings because hospitals and some of the areas that are exempt from the CDC indoor recommendations are things like public transportation, buses, hospitals, correctional facilities, and things like that. Having said that, I think one of the things that CDC said was, follow your state's guidance. So one is we look at our own state's guidance and see what they say. Then having said all of those things, I think one must look at your own comfort level and think about who you're with. Are you very confident of everyone's vaccination status, around you? Are you very confident of everyone's health status around you? And then how confident are you about yourself? So all of those things go into, your decision-making. If you feel more comfortable wearing a mask, a simple cloth mask or a surgical mask, and that's what gives you the most satisfaction, then I wouldn't force yourself to go against that just because, someone else is saying that. You have to do also things that you feel comfortable about. So it's a little tricky. I think we have to ruminate over this. Questioning is good. Having discussions is good. Let's parse it out. That's all good. And then finally, hopefully, people will feel much more comfortable taking off their masks.
Thank you. Are there any? We have 4 minutes left. Are there any?
Akeem wanted to say something.
Oh, please, Akeem. Yes,
yeah,
sorry.
I just saw his mute come off. So
please.
Yeah.
No, I was just gonna talk about the comfort levels. We got the guidance, and I went to one store yesterday, and there was a sign that actually said, you can mask are optional. And then the store next door still had the signs up. But in both places, everyone was still wearing a mask. I'm fully vaccinated. I have been for a while. I'm still in the same boat as you. I'm uncomfortable taking off my mask, and not because I have any concerns about the vaccine's effectiveness, but because we've been wearing a mask for a year now, and they are a part of our protection. So I would want to say to everyone, ultimately, protect yourselves, protect your family. If you know you live with someone who is older or maybe more at risk for having a rare case of COVID, then please continue to follow the previous guidelines of wearing a mask, keeping hand sanitizers, and ultimately, if you want to stop the spread and kind of make this disease go away, you want to stay safe and protect yourself. I wouldn't worry about the environment that I'm in as much as far as with everyone else. So if you know you're protected and you're wearing a mask, then you have a pretty strong chance of not contracting COVID-19 virus.
Thank you, both of you, for that. I'm sure there's a lot of confusion.
Yeah. However, I would just like to add one thing. One of the reasons the CDC also came out with this guidance is that people should feel more comfortable gathering in small groups if everyone is vaccinated. For example, a group of friends. That's a social activity most of us have missed out on. And if you feel pretty confident that all of your friends are, vaccinated, which means you at least have to give 2 weeks post your last or your second dose of the vaccine for the Pfizer Moderna, and at least 2 weeks for the J&J. So if you feel pretty confident and you have a small group of friends, I think, the CDC is saying, please, hang out and socialize. Not if you're sick or ill. If you still have symptoms, people are expected to quarantine because breakthrough infections are possible. Nothing is 100%. So I think you have to still keep in mind how your health is, how your people's health is. And then if you feel all situations work okay, there's no harm in socializing. And that's an important part of being human too. You have to learn to reconnect with other human beings in order to feel happy. And I think part of the pandemic's most sad effect was that we lost some of these social connections.
Thank you. I've learned a great deal, and hopefully our participants have also learned a lot. Please remember that this link will be alive for quite a while. Right now, we have no shutdown time. So please, if you've learned, if you've enjoyed, if you want to pass this information along from our experts to colleagues, to friends, to family, please know that the link is still active and will still be active. I'd like to close by just asking our participants, our panelist and our presenter, if there's any closure that you'd like to say for the next 30 seconds.
I don't have anything. Akeem, do you have anything else to say just to wind up?
Of course. Sure. So the first thing I want to say is participate in research. We have these questions and we need to find the answers, and how we find the answers is by having human trial research. We start research in a laboratory in cells, and then we find it safe, and we move to animals and we find it safe. Then we move to humans in different levels and find it safe. And the reason that we may not have these answers yet is because we don't have enough participation across different ages and genders and ethnicities. So if we want to find the answers sooner, please participate in research. Also, if you feel uncomfortable not wearing a mask outside, go out, take a walk by yourself, and keep a mask in your pocket. And if people start to crowd you, put your mask on and run away.
So thank you, Akeem. That was absolutely accurate. I'd like to just add that if anyone listening now or later on would like to participate in one of these clinical trials that are actively ongoing at NYU, please email Krina Shah, KRINA.Shah, SHAH, at nyulangone.org. So just to repeat again, Krina, KRINA.Shah, SHAH, at nyulangone.org. And we will reach out to the people that are talking to you today. So thank you very much. Our next snippet will be in June, and it will be led by a community leader in Brooklyn, and it will be discussing truck traffic and health effects associated with air pollution from traffic, whether it's trucks or cars. And unfortunately, many people live near expressways and highways. And so please look out for that, and please join us for our next snippet. Thank you all very much, and please stay safe.